my friend and supporter, welcome to medical science class. As a student of medical science, I have honor to take flavor every branch of science. What kind of things they do, that is birth, that is knowledge, that is essence, that is good work, that is an art. Those are, believe me, as a doctor, Dr. Sohel, uh, for them. How much patient? Ya alif lam nam. Yaldav shapi, yaldav mapi, yaldav kapi. Anar Abdul Mahmud Shafi, Anar Abdul Mahmud Mafi, Anar Abdul Mahmud Kafi. Now my friend is supporter, correct within a 1 minute. Wait. And in case of those are doctor confirm that, and patient also give the sign. Now I feel better. Can I leave the hospital and check your pulse rate, adult, but check your pulse rate, death rate, child pulse rate equal more or less 70, best is equal more or less 16, adult patient. In case of children, infants, see the pulse rate, death rate in children, neonate to children, neonate to 14 years chart. Understand? Then patient also confirm that I am okay. And feel your, if you want to see your pulse rate, check your pulse rate, 70 beat or not, equal more or less adult. And also bed rate 6 equal more or less 16 breath per minute or not. Also hot cause you come in hospital, that cure or not. And like redness, swelling, tumor, redness, swelling, hot symptom. What is the reason you come? That is called hot symptom. Come, pain, redness, swelling, raise of temperature, and check the temperature remain normal or not, and correct or not. Equal about in case of temperature. How much? More or less you 97 degree Fahrenheit. In case of Celsius 36 point something degree Celsius. Check that. If equal more or less 99, no problem. Okay, fine. Now my friend and supporter correct. Patient also gives sign corrected. And doctor will also take that document to correct, not remark or not do anything, with document evidence. Now my friend and supporter, medical science class, we learn medical science. I also learn medical science. I am also creation, improvement. In case of medicine main book, what I read, 20 edition of short Dr. Mohammed Shujudi read, 20 edition of Sir Stanley Davidson. You open the page and say me any word, any sentence, any alphabet you say what that. Not only me, but also any doctor can say that perfectly. No. That is the proven by book, Davidson book, or any book. Who you read, open the page number and say. Also Al Quran. You open the page number and say what number verse is that, how much word remain, how much alphabet remain. Any Hafiz, any scholar can say that. All are creation proved by Holy Book, Al Quran. Also medical science book, also other book. Okay, fine. Now in your mind scale, what remain? Anyone say that? What is my mind scale? Anyone, anybody can say that? Only one and only creators can say that. No, that. Now, by that art, you can understand who is creator. No need fight, no need argue, no need debate. Creator know your mind skill, not only mind skill but also brain. Know your future. You say, what is my future after 1 minute? Everybody say you remain there. Now I stand up and gain self for one indicator and leave that and go. You know that? No, no case, no. Except one and only. Now coming. I also not know that I do that. I am also creation. I also not know my future. Also medical science, heart, by mind, by brain skill, brain, you can understand who is creator. If creator come in front of you, you can understand. Invisible to visible format, you can understand that. If believe one and only creator, no medical science, and follow the rules regulation of one and only creator. Now, in brain, somebody say brain is the mind, science, medical as per medical science. But brain give you way. Brain give you so many way. Brain give you so many way. What I do, like that, brain say, everybody say that. That is the reason I change that. Only creator know that. How? Brain give the way. But this problem, what you do, past, present, future, what is your plan? But mind say yes, no, very good. That is not proper situation to do that. Stop. For example, I have in my pocket equal more or less 20 taka. Now I not take as a chain smoker, not take a smoky or tea in tea shop. Now after lecture I do that. Unusual can do that. But now I try to saving money. Then I can do that. If addicted, do that. Now mind say, what mind say? And mind say yes, no, very good. You continue that or not? You continue that or not? That is the reason. Mind say that. That is the reason brain and mind. Brain scale and mind scale. What is the brain scale and what is the mind scale? And medical science discuss elaborated about creation like, unification like, Homo sapiens, human, mankind. And discuss elaborated about that. Now story by heart, type 1 hypertension. Anyone, type 1, what is type 1 hypertension? If your diastolic pressure, above pressure is equal more or above 139 and diastolic pressure above and equal more 100 and systolic pressure equal more 139, then that is called type 1 hypertension. In that hypertension you need medication or not? How do you take BP tablet? How can you correct that? Reduce salt and fluid intake output you can control. How can control? If pressure high above 140, take less fluid and less fluid and then blood volume will reduce, your pressure come normal. If blood pressure low, then take sodium salt, sodium chloride solution, saline, one saline. By that policy you can control type 1 hypertension. Any doctor can know that except me, except MSc, except my A to Z person, except one and only Ketor Yellow. One and only Ketor Yellow has all disease correction and solution, all problem solution. Not any patient. I am also the patient. But in that case, any doctor, any doctor can know that policy can control without drug type 1 hypertension. You can control not only type 1 but also type 2, type 3, type 4 without drug. I will cure. Try to understand that. We discuss elaborate about next class. Until you can check by the permission of your doctor. By the permission of your doctor. Thank you very much. Today is enough for medical science class. I am representative of Dr. Mohammad Shoaib Choudhury. Those are my patients. They call me Dr.